Hello, everyone. You welcome back to our webcasts. This Today we'll be talking about a topic called Introduction to Psycho-Oncological Aspects of Cancer Management. So, basically, focusing on what is the psychosocial component of looking after cancer patients. This is based on slides provided by Mrs. Akaniyele Nsikak Godfrey, an oncology nurse at University of Uyo Teaching Hospital in Nigeria. We hope that at the end of this presentation, you should be able to understand the basics of psycho-oncology and also integrate elements of psycho-oncology into your practice. We hope you learn skills that can improve your emotional well-being, those of your staff, those of your families, and those of your patients and their families within cancer care. So the field of psycho-oncology is essentially a multidisciplinary aspect of cancer management that is concerned with emotional responses. And this is a very important aspect of our course that I really like you to pay attention to. So it looks after the emotional aspect of the patients, their families, and of course the clinical staff. And I have to emphasize the clinical staff because everybody is affected by cancer, whether or not you have a tumor or not. Now, this aspect deals with the psychological issues, social issues, behavioral issues that come with anything related to cancer. And why is this important? I don't know if you've ever had a cancer diagnosis, but having worked in this field for a while, you realize that a cancer diagnosis makes everyone anxious. The patients are worried about their life today and their life in the future. Their families are concerned about what's going to happen to their loved one, and the clinical staff are burdened with decision making, sometimes making impossible decisions of life and death, or whom to give, whom to treat, or not to treat when they have very limited resources. So it's important that you, as a clinician, you need to have the skills to be able to manage this and identify issues early. Let's move on. Now, a typical cancer patient, their journey isn't the journey of a cancer patient is not a straight line that goes this way or that comes down this way. No, it's a journey of ups and downs. And for instance, at point of diagnosis, the patient could be like, "Oh, I have cancer. Maybe I'm going to die from this cancer." They're worried. And then we start treatment and they feel low with fatigue, and after treatment is done, they bounce back. But the next time the cancer comes back, if during remission the cancer might come back or relapse, and you will be dealing with issues regarding depression. I'm like, oh my goodness, I am going down finally. And then the treatment works again, and they're like, "Yay, we survived!" So it's the bounce up and down in the emotional spectrum, and of course, for women, it's about like family, and that's like a typical breast cancer patient. So in handling cancer patients, it's important that you're skilled in how to approach them and communicate. The first aspect of this topic deals with breaking bad news. And in breaking bad news, and there are lots of slides that are going to show you how this is done and give you a lot of examples. But breaking bad news is essentially a way for the clinician to be thoughtful in how they give the news to the patients and not just like, "Madam, sorry, the result came back yesterday. It said you have breast cancer on the right. Sorry to that." No, we use what we call the SPIKES approach. And SPIKES is an acronym for setup, SPIKES is an acronym for setup, perception, invitation, knowledge, emotion, and then you summarize what we've discussed. And there are several slides in the presentation that deal on this properly. And I really encourage you to check them out and try them as and play with the scenarios in your head as you go through the course. Now, One thing about communication in cancer is that the patients are going to ask you, am I going to die? So the next aspects of this course, after the slides, in the slides that you in the handout, deal on communication. So if a patient asks you, Doctor, am I going to die? Of course, you have to be honest and acknowledge the fact that there is a lot of uncertainty. So you would be like, well, about half of the patients who we see with this condition, that's with this kind of cancer, at this stage, may live up to 10 months, 100 months. You never say, you should never say, yes, you're going to die in 6 months. Prepare your house. It's not the best way to break news. And most of the research that is done regarding um, uh, like survivorship or how much time a patient has, they give you the median time, and that median time is half of the patients. So try to remember this scenario that communication is very important. How you break the news is even more sometimes remembered than what you did in terms of treatment. So when you have communicating with patients, remember to provide realistic hope. And they'll appreciate it if you tell them the truth, but then that you know about the cancer and you tell them the truth, but you do not make it so serious that you forget to lighten things up for them a little bit. And at the end of your discussion, try to provide them with options depending on what's available around you. If the end comes when the show will come, it's not very nice to say there is nothing more one can do, because there is always something someone can do, but we need help. So kind of balance this in your discussion. Okay, so now we'll move on a little bit and away from the communication thing to go into depression and anxiety. These are two issues that the cancer patients might face, and so I like you to take a look at the slides that are talking about depression and anxiety. So here we're using the GAD-7 scale to uh, screen for the anxiety. So whenever you see a cancer patient, let's say during follow-up or after, whenever you see them in the course of clinical care, take out some time, 2 minutes, and ask the following questions. Over the last 2 weeks, how often do you think you've been bothered by any of the following problems? And then you go over the answers. You go over the answers with them. Like the answers could be not at all, several days, more than half of the days, or nearly every day. These are the kind of answers they might give you, and this is how it's scored. So you try to ask these questions to find out if they are depressed, and if they are, you try to rate how if they're anxious, try to rate how anxious they are between mild, moderate, and severe. This will help you manage their anxiety as they develop. Okay, and the other thing is depression. Just like we did in anxiety, there is this PHQ-9 questionnaire, which I've tried to summarize in the slide here, that help you screen for depression in your patient, because these are things that will come. And if you do not understand them and try to manage them, it will be treating the cancer and the patient is dying inside slowly. Okay, so just get through the slides and the handouts that you have, and you get to appreciate them. Now, one of the most important parts of this topic is looking after the clinical staff, because doctors, nurses, and other support staff are humans. So we need to understand that cancer affects physicians as well, and nurses. Sometimes physicians who manage cancers have expressed that they're angry, they feel frustrated, the X-ray is not working, or they've not been paid salaries, they're even depressed. Now, people who manage cancers are at the risk of burnout. And burnout is a big issue. In fact, we have a survey in this course that we'd like you to take and let us know what your experience with burnout is. And this will help us design an intervention to help you as you continue managing cancer patients in Nigeria. So, when people have burnout, what happens? It affects their relationship and their families. A lot of people take to alcohol, and there could be depression. It's not news anymore that physicians are taking their own life by suicide. And of course, people just keep changing jobs. And when you have all these conditions, your patients are not satisfied because you are not performing very well. So, the common symptoms of burnout are like frustration, you get irritable, you feel tense and angry, and there are some physical symptoms where you're always tired and you cannot sleep, there's headache, and all sorts of aches. Burnout is real. Okay, so this is the final slide I have, and I just want to go to look at the content regarding burnouts, anxiety, depression, and communication. Those are the four areas we covered today. And there's also discussion on end of life care. And I encourage you to please do a survey telling us about burnouts and your experience regarding psycho social oncology. I'll see you in the next presentation.